Good morning. This morning I am joined by Mayor Greg Fisher from Louisville, Mayor Linda Gorton from Lexington, Judge Alex Barnett, Harrison County, Cynthiana Mayor James Smith, Dr. Crystal Miller, Director of WEDCO. That is the local health department that covers multiple counties, including Harrison County. CHFS Secretary Eric Freelander, Dr. Stephen Stack, our Commissioner of Public Health, and Russ Cox, President and CEO of Norton Healthcare. If I missed anybody, they'll introduce themselves in a minute. But as you can see, we are all here together this morning because we are all working together. And together, both the group up here and all of us as Kentuckians are going to get through this. We're going to provide some new details and new information today. We hope the public understands that there is limitation on what details we can provide and also when we can provide them based on the process that the epidemiologists and others go through. We're going to try to provide as many of these details in context because, again, we want to make sure that people remain calm and understand that we will get through this. As of yesterday afternoon, we have 4 confirmed cases of the novel coronavirus here in Kentucky. Now, just because that may be a few more cases than some states are reporting does not indicate that Kentucky has been hit harder than other places. I believe it just means we've been very aggressive in our response. We have 2 people who have tested positive in Harrison County, 1 in Fayette County, 1 in Jefferson County. They are all currently in isolation. The Harrison County very first patient is improving. We're very glad to report that. We can also today disclose that the 2 patients from Harrison County are linked, though we can't provide details on that linkage at this time. The Fayette County individual is a resident of Fayette County, and the Jefferson County individual is a resident of Jefferson County. At this time, we have only found travel history in 1 of these 4 individuals. So we believe, and this seems to be the case nationally, that this is community spreading, spreading from person to person. Again, that has been expected. We are ready for it. It was what we always thought that we would see with this novel coronavirus. But what it also means is that important hygiene that we have been talking about is so critical. It's important for you and your family members to wash your hands very well, multiple times a day, more than you normally do. Make sure that if you're sick, you stay home. For our businesses, make sure that you have options for individuals that are sick, working from home or enough paid sick leave to make sure that the individual does stay home. If your kids are sick, they shouldn't go to school. Let's just make sure that we make the right and the smart decisions just to protect each other. And again, the way we get through this is the way we get through everything in Kentucky, by being good neighbors and by looking out for each other. Couple of steps we've taken on the state level, and then there's a number of community steps that'll be talked about in a minute. Declared a state of emergency a number of days ago. That makes sure that we have every tool that we need to address this situation. We are removing any impediments to getting someone tested or treated on Medicaid. We're going to eliminate prior authorizations or any other issues that would cause pushback within that Medicaid system. Today, I will be issuing an executive order that will waive copays, deductibles, cost sharing, and diagnostic testing fees for private insurance and state employees. There's about 433,000 Kentuckians on private insurance and up to about 30,000 state employees. And we're also going to be telling providers to expand their networks to patients that may go outside their normal providers. Again, we want to make sure that there aren't any cost or other impediments as we move forward. We set up a specific hotline for those that have concerns on the coronavirus. That number is 1-800-722-5725. We've had a significant number of calls to that hotline, which is good. It means that people are communicating and that we are able to communicate back with them. On the state side, we have put steps in motion to where everybody is going to have enough paid sick leave. I believe we have to set the example for the rest of the state. The way state employees work is that they accrue sick time depending on the amount of time that they've served. We're going to make sure that someone who just started yesterday, if they need to be at home, can be at home as we get through this. A couple of reminders from what the CDC has put out. The people over 60 or people who have had heart, lung, or kidney disease ought to avoid large crowds. People should really take heed of that advice. And at this time on our website, we have the details for how we are recommending that senior centers, nursing homes, long-term care centers, those that help our seniors should restrict visitation. It's just to make sure that we protect our loved ones. So again, we are going to get through this. We are going to hear about more positive tests. We ought to be prepared for that. But as you will hear today, we are working seamlessly from the state to the local level to make sure that we are responding and responding appropriately. I'm going to let the folks from Harrison County come up here in just a second, but at this point, we can provide an additional detail for the first individual in Harrison County, and it's important that the facts that we report in context. For those that were here a couple days ago, we talked a little bit about that if even a tweet that doesn't contain the context that it needs could potentially cause more fear in people than is merited. And as you all know, fear can cause more damage than what we're facing here. So the first individual from Cynthiana worked at the local Walmart. Now, at this point, every coworker that we have contacted, while they are going to self-isolate, none of them have shown symptoms. I think that's a very important fact to put in context of where this individual worked. I'm now going to call Dr. Crystal Miller up, who is working directly with this Walmart about the different steps that they are taking together. And then we'll hear from Judge Barnett and Mayor Smith about some important information that they've already gotten out, being a model about how folks in Harrison County can protect themselves. Dr. Miller.
Thank you. Good morning. I want to first thank Governor Beshear and his staff for the transparency in this situation. Dr. Stack and the Department for Public Health have been an invaluable support, as well as our local elected officials and community partners in Harrison County. The outpouring of support that we have received shows the care that Kentuckians have for our state, and I'm proud to be a Kentuckian. We were notified on Friday at 5 p.m. of our first case in Harrison County. We began immediate epidemiological investigation, and we quickly learned that that was a Walmart employee. We had a community partners meeting, and we notified Walmart and worked closely with Walmart and our local hospital on details about this patient. I cannot express the importance of that partnership. Walmart has followed every guideline. They have been at the table working hand in hand with us and providing every detail that we have needed to do our investigation. We worked through the weekend investigating contacts, and we have self-isolated 6 employees who worked around this patient. As Governor Beshear said, none of those contacts are showing symptoms, so that's hopeful. And yesterday, we received a second confirmation of a second positive case in Harrison County. We have began contact investigation on that patient, and we have linked those patients together. So we do show linkages. I want to thank our community in Harrison County. The community is doing an outstanding job of rallying together and doing whatever is needed. Walmart is a valuable entity in that community. We are working hand in hand with first responders and other officials, having weekly meetings on situational updates. I cannot express the level of support behind Harrison County in this endeavor. As we move forward working with Lexington and Louisville, we offer our support as you all get into the investigation on COVID-19. Thank you.
That's okay. And while at this point, given the process that the epidemiologists have to go through, we can't provide details of the link between the two patients in Harrison County, I do believe that it's fair to disclose that right now we don't believe it is the Walmart. So for everybody who has been through that Walmart, I know it's going to make you nervous. Just because you've been there doesn't mean that you have the coronavirus, right? So again, we have to stay calm, hopefully report these facts in context, because this is something that we've got to make sure that our people get through, that we continue to face it with compassion to our fellow human being and fellow Kentuckian. So now I'm going to ask Judge Alex Barnett to talk a little bit about the information campaign that they are doing in Harrison County. Let me say, Dr. Miller, Judge Barnett, and Mayor Smith are a real credit to their community. This was the very first place that we had a positive test, and they were ready to step up and do whatever it would take. They have done it calmly, and their leadership, I believe, is exactly what we need in that area. So, Judge Barnett.
Thank you, Governor. I first want to thank the governor and all the state officials for their response to the coronavirus in Harrison County. It's been phenomenal to see all the support that they're giving us. We are tackling this head on. Then I want to thank WEDCO and Dr. Miller for all their work that they're doing in Harrison County, and the importance of a strong local health department is really coming to the forefront right now in Harrison County. As you know, we have a rural, tight community, and we're very fortunate to still have our own newspaper and our own radio station. The mayor, as we were driving up this morning, they interviewed the mayor live on the radio the whole way. And our Cynthiana Democrat has agreed to print a special copy about the coronavirus. And this will be put in every mailbox in Harrison County this morning. It will include what is the latest news on the coronavirus and instructions of what to do with the coronavirus in our community. And we're very fortunate to have that ability, and want to thank the Cynthiana Democrat for agreeing to do that. Communication is a key. Getting word out, what to do, what to expect, and not everyone in rural communities has internet and has social media and has the ability to get that, and we're so fortunate to be able to get that in their hands and get the information out there. Well, thank you very much.
Thank you. Mayor?
Thank you. Mayor Smith from Cynthiana. If anyone had told me a week ago that Cynthiana would be leading Louisville and Lexington in anything, I would have been very, very, very surprised. But we are. And I think it's safe to say that Cynthiana is probably the most disinfected city in the state of Kentucky today. We are responding to this with the judge and Dr. Miller and the state in doing everything that we possibly can to keep our citizens safe. I know some people think that we're overreacting, and some people think that we're not doing enough. But we are using our wisdom, we are deferring to the professionals, and we are doing everything that we need to do to keep our citizens safe. We have a meeting this morning starting at 10 o'clock with all of our first responders and hearing what they are doing to make sure that we can continue to provide police safety, fire safety, water safety, all the things that we need to continue to provide as a city and as a county government. We are working step by step by step with the experts to make sure that we can continue to do that. So that's all I have to say, and I hope that the citizens out there know how proud the judge and I are of how Cynthiana and Harrison County residents are responding to this. You're responding with calm, you're not panicking, you're going about business as usual, but still taking the proper precautions to prevent the spread of this community-wide. So thank you all very much.
Thank you. Next up, we'll hear from Lexington Mayor Linda Gorton.
Good morning. Thank you very much, Governor Beshear, and also Dr. Steve Stack for your transparency as well as gathering us all together for information sharing. A few of the things that we have been doing in Lexington, before we had a case, and as we were preparing some time ago, we stood up a group of stakeholders in Lexington, which is a wide variety of partners, everything from public schools to transportation to business to health department, many stakeholders, and we have already been meeting. And starting this week, we'll be having our phone conferences weekly so that we can all be on the same page. We have shared digitally the coronavirus information, which Judge Barnett showed you on the back page of their newspaper, and we've been sharing that widely in Fayette County and beyond. We also have asked, since we learned that we have our first case in a Lexingtonian, we have put out the word last night that folks should follow those CDC guidelines if you're over 60 or if you have chronic health problems, which were mentioned earlier. We advise you to avoid large crowds. And so we're getting that information out to our folks, and we are sharing widely the information which the governor and Dr. Stack are giving us. We're working with our Fayette County Health Commissioner, Dr. Craig Humbaugh. Thank you.
Thank you, Mayor. Next up is Louisville Mayor Greg Fisher.
I want to thank the governor for all the good work that he's been doing in terms of statewide communication, and certainly we've been in close contact in Louisville as well. Norton Hospital, Russ Cox, for you and your team. I mean, the critical thing I think that many of our citizens want to see is that we are all communicating in real time on this, sharing the information as it becomes available, because this virus, unfortunately, is going to spread everywhere, just like the flu does, okay? And we want people to be reacting to it just like they would take normal health precautions with the flu. So it's just a new reality that we have, and we will work through it. As was announced yesterday, Jefferson County has its first confirmed case of COVID-19. The patient currently is at Norton Brownsboro Hospital, and we are committed to sharing all the details as quickly as we can and as transparently as we can within the protocols that are out there. I do want to emphasize to our citizens to go to the state website as the definitive source of information on this. Do not get your health care advice from the internet and various social media strains that are out there reporting all types of conspiracy theories. That is bunk. Again, trust the state website for the information that's real about this health challenge that we're going through. I want to also say that we're grateful for the strong coordination and communication with the governor's office and the State Department of Health. The State Department of Health is in regular contact with Dr. Sarah Moyer and our team at the Louisville Public Health and Wellness Department. So it is natural right now for people to have concerns and questions about what's going on. That's why communication such as this is so important. And we knew it was just a matter of time, obviously, before COVID-19 came to Kentucky and came to each and every one of our cities, just like they have cities all around America right now. And I just want to emphasize for us in Louisville, and I'm sure I can say this for all of the elected officials up here, our number one job is public health and public safety, and that's why you will continue to see the kind of emphasis that we've been placing on community knowledge that we have been. This morning in Louisville, my senior leadership team is reviewing our protocols and procedures in the event of a community-wide wide outbreak to ensure we have appropriate procedures in place to keep the Louisville community safe, both in an individual capacity, but then in a community capacity as well. And I will brief the local media at 11:45 this morning on those protocols along with various community partners. And then we will keep our local media briefed every day on this until the situation subsides. So I want to thank the media for continuing to cover this in such a measured way and all of the great partners we have here on the stage. Thanks, everybody.
Next, we have Russ Cox, the president and CEO of Norton. I will say when I called Russ last night, his response was exactly what we need to see. Number one, it was calm. Number two, he said they were ready. And number three, it was the compassion that we want to see, that they are there to help people. So, Russ.
Thank you, Governor. It was calm outside to the governor, but very much excited to get engaged with the preparation that we have to deal with this situation that I felt inside. It's amazing that within an hour of a positive test result, that I had a conversation with Governor Beshear, Mayor Fisher, and we were fully engaged in taking care of the patient and sharing information that needed to be shared. As is mentioned, the patient is at Norton Brownsboro Hospital, is in isolation. We immediately began the task of looking at everyone that had been in contact with the patient, employee and otherwise. We will continue to follow our processes. We will continue to share information with the network of hospitals across the state of Kentucky. I've been in conversation with Dr. Newman at University of Kentucky, as well as other hospital systems. One of the great things about the state of Kentucky is that we have caring hospital systems that are prepared and constantly stay prepared for this event. So we will continue to work hard to communicate, to be transparent, and to continue to work with the governor and mayor's office to take care of people of the state of Kentucky. Thank you.
All right. Next up is going to be our Public Health Commissioner, Dr. Stephen Stack. Let me say that our Public Health Department have been all-stars in this process. I'm not sure that any of them have slept in the past 4 or so days, but they are a true testament to what we do when faced with something like this. They have worked so hard. We are so proud of them inside of this state, everything from getting our lab up earlier than many, to cutting the turnaround time in many instances to half a day, to the way that they have been communicating with all the local health departments. I'm very proud of their work, very proud of Dr. Stack's leadership. Steve?
Thank you.
Thank you.
Thank you, Governor. Knowledge is power, and I want to continue to emphasize what you've heard the others say. It's important to be informed. The fear of the unknown usually outweighs and is greater than the fear that's required. A few things for you to consider, and this data will evolve because remember, this disease did not exist in human population until December 2019, at least as far as we're aware. We're just over 2.5 months into our learning about this disease and our response. But for 80% or more of people who get infected, you're going to be just fine. You'll probably either have cold symptoms or no symptoms. So for 80% or more of people, the current data says you will be fine. For parents, for your children, children appear to be little or no infected by this condition. Of course, if you have a special needs child or a child with chronic medical conditions, you should take extra precautions. But for children, they appear to not be significantly affected by this condition. So parents should take some measure of calm for the well-being of their children and their families. For those who may get infection and may have a more serious infection, we can target efforts towards those populations, and we will continue to make guidance available to the state of Kentucky through our website and other channels to try to protect those communities as well we're able. To that end, I'd continue to remind you to please go to our website. It's kycovid19.ky.gov. We are updating multiple times a day the data and the advisories we put there in order to make sure everyone has accurate information and the same information. We will continue to urge you to tell the communities to go to that website to seek that information. For those who have concerns and they feel they need to talk to a person to try to ask questions, use our 800 number, 800-722-5725. That's 800-722-5725. The recommendations I would share with you right now are the ones we've all been sharing, and I think you've heard this nationwide from almost everyone who's done an event like this. The things that prevent respiratory infections are helpful for the flu, and they're helpful for COVID-19, and they're helpful for other things. Cover your sneeze and your cough, wash your hands frequently with soap and water, use hand sanitizer when water and soap are not available, Stay away from others who are visibly sick. 6 feet is generally the recommended distance to help minimize spread of droplet-borne infection. And if you yourself or your children or family members are sick, stay at home and please do not go to work and school. I will add that I make the request of employers and others, support your employees. If they are sick, support them in staying home. It will be better for them and better for your employment place and for the community. So please support them in that. And for possibly more vulnerable communities, we are recommending for those who are over 60 or have chronic medical conditions such as heart disease, lung disease, diabetes, and other conditions that you stay away from densely compacted engagements and minimize your social activity outside in order to minimize your risk of exposure. And for nursing homes and other long-term care facilities and confined populations, we are recommending restrictions on visitation in order to protect those communities. That guidance is on our website. In closing, I'd like to thank the governor and all the people behind me on this stage. I hope what you're seeing here is the sincere expression of collaboration and partnership. The pride that Dr. Miller expresses in being a Kentuckian is one I think we all share. We are hard at work on your behalf, and as I step away from the microphone, I have to thank my laboratory staff, the public health staff, and all the people in the Kentucky Department of Public Health, in partnership with the many others, who are staying up all night long, fielding calls, and trying to respond as aggressively as we can. We're committed to getting you accurate and reliable information as quickly as we can. When we can't get you information, it's because we're busy at work protecting you, or we're trying to make sure the information we give is reliable. So thank you, Governor Beshear, for your leadership and your support.
Thank you. Before we hear from Eric Freelander, let me do the necessary context of talking about the flu too. The flu, right now we have 4 confirmed cases of the novel coronavirus. We, I believe, have about 19,000 confirmed cases of the flu this year. We've had 66 plus deaths from the flu, and the flu still hits children. So get your flu shot as well, and then make sure that you are practicing those same hygiene, the same hygiene that would protect you from both the coronavirus and from the flu. Make sure that we don't take our eye off the flu because of its very serious impacts. So now our Secretary for the Cabinet for Health and Family Services, Eric Freelander.
First, I want to say I've worked for the Cabinet for Health and Family Services for over 30 years. And those with long memories will know this is not the first time we've seen something like this occur. H1N1, bird flu, other things like that. This is what we do in public health. This is why public health is so important. You've heard about the collaboration. You see the collaboration. I hope you feel the collaboration. This is how we operate in Kentucky. As you heard about how our epidemiologists work, you heard about how we trace and we try to find contacts and we try to make connections so that we understand how disease spreads, then how do we mitigate those issues that lead to spread. These are all things that we have done before and we continue to do. So this is something that I want everyone to know. This is not something new. While this is a novel coronavirus, this is not novel to Kentucky. We've seen these things before. We will, indeed, get through this. This, I believe, is an example of why I'm proud to be a Kentuckian. We come together at times like this. We were able to bring everybody here to have this discussion, to reach out, to make sure we were communicating within hours of understanding that we had new cases. So, again, wash your hands. Make sure you practice good personal hygiene. At this point, say hello in this way. And make sure then that we don't turn away from each other, that we turn towards each other, because again, that's what makes Kentucky, Kentucky. Thank you.
We'll now open it up to questions. I will say that we're not going to be able to provide any more factual details on these 4 cases. I know you're probably going to have to ask, But we've provided the details that we can at this time, given the process that the epidemiologists go through and needing the time to go through that process.
How many people are being monitored that haven't been tested?
So the question is, how many people have been monitored who have not been tested? And at the moment, I don't have the specific answer, but I want to frame that for why the situation changes. As we now have known cases, and as hopefully the commercial laboratories are able to test more widely, the number of people being monitored no longer becomes of similar importance as just reporting the number of positive cases and the steps we're taking to reduce the increase in that number. So at this point, I believe we have around 200 people that have been or are being actively monitored. But again, we'll soon stop reporting that data as we shift to a different type of reporting as our response efforts change.
And as the private labs come online and as there's more widespread testing, we're going to learn a lot. Like Dr. Stack said, we believe that this coronavirus was discovered or we first saw it about 2.5 months ago. So our goal is to continue to be fluid. As you can tell, we are on top of what we are learning minute by minute, and we are doing our best to communicate responsibly with the public as quickly as possible. Jack.
The Walmart in Cynthiana, did it ever close? And can you just say it's safe to shop there?
It did not close. We made immediate contact. Remember, we learned about this less than 2.5 days ago, although it feels much longer than that. We worked closely with Walmart management throughout the weekend. They have ramped up their disinfectants, their number of cleanings, but they did not close.
I'll say it. And we don't have any reason to believe that it's dangerous to go to that Cynthiana Walmart right now. And we know how important Walmart is to a community. Right, and it's important, just like individuals not being shunned, and that's something we're really going to have to talk about as we get through this. Just because somebody tests positive for the coronavirus, ultimately is okay, comes out of it on the other end. We got to make sure that these are people that are accepted back in, and that we don't ostracize them in any way. I think it's the same here. For Walmart. This is going to happen in businesses all over the United States. We believe that this business has responded very appropriately.
For Mr. Cox or anybody else who wants to answer, what concern is there that hospitals could potentially be overrun?
As I mentioned earlier, we've been looking at contingency plans for some time on this and capacity plans throughout the city in coordination with the mayor's office and with Governor Beshear. Now, obviously, it's hard for us to predict that, but we will all be running at maximum capacity and have the ability to do so to handle this, and we feel like we can be very planful about it.
Are y'all going to be canceling elective surgeries to free up room?
At this point, there are no cancellations of elective surgeries.
Dr. Stack.
Cox, talk about what it means to state isolation. Talk us through exactly what that is and what that is.
If we can, right before that, Dr. Stack has an add-on from the state.
So for your healthcare workers, I'm an emergency physician. I worked my last shift about a week ago. I want you to know they're there for you. I mean, they endanger themselves on a daily basis to take care of their people and their communities, even though that means that they place themselves or their families at risk. So please be kind, be courteous, be appreciative of the efforts that they do, because they're under stress too. Remember, when they go to an emergency department to take care of patients, there is no other place that better concentrates illness and places them at risk, and yet they show up every day to care for folks. So please be thankful for the work they do. The second thing, though, I would say I think this is very important, and if we can get the message out, it would be very helpful. The hospitals and the healthcare facilities across the Commonwealth are ready to try to help you, just like the state is. But if you are worried well, do not go to a hospital, an ER, or a doctor's office. If you are worried well, you are well, and going to the hospital or a healthcare setting just further overwhelms them and concentrates people. So if you are worried well, stay home. If you are ill, but otherwise would not have sought care, you have a fever, you have a cough, you are concerned you have an infection, but otherwise, if it weren't for COVID-19, you would not have sought care. Do not go and seek care at an ER, a hospital, or a doctor's office. If you want advice, call our 800 number or call your local healthcare provider and ask advice by phone or do telemedicine, again, to minimize taking people with infection and exposing yourself to others. The third category is if you are sick and you feel you have an emergency, then call your doctor or seek medical care. But I think most people understand when they are really sick and when they really need to seek medical care. Those individuals should seek care, and the hospitals behind me and across the state stand ready to serve you. But if we can please self-triage so that the sickest people get care and the rest don't crowd the system, we will have better resource capacity to care for everyone and minimize the spread of infection.
Is this something that can be comparable to the flu? Because as you mentioned, 8% will be able to get over. You mentioned our older adults will be our most susceptible and keeping them away. So is this something, I guess, to ease the panic, you're mentioning if you have these symptoms, don't run to the hospital necessarily. Is it comparable?
Well, what we've seen thus far is that the flu is significantly more widespread. We are still learning about this novel coronavirus, but when you look at 4 confirmed cases in Kentucky, that we will have more, and we expect more, with 19,000 cases of the flu, and then we look at the fact that we have lost 66 plus Kentuckians to the flu. I think that ought to put people's worry into context. It means we ought to remain calm. It also means we ought to worry about the flu a little bit more, but that we need to remain calm in how we deal with this. I think one of the main takeaways is that we need to look out for our senior Kentuckians and those that are medically fragile.
Is Cynthia Walmart providing paid sick leave, or is it changing its sick leave policy? Can you talk about that?
We ought to make sure that we get that directly from them, unless you have that information. But our understanding is that they've said they're going to look out for their employees, but let's make sure we get that directly from them. I believe we're going to have a statement from Walmart here soon.
Whoever can answer this question, there was a case confirmed in D.C. That person had visited Louisville, specifically a conference at the Omni Hotel. Any special precautions being taken there? What's the latest there?
I'll let Dr. Stack respond to that, but with what we have seen in these 4 cases, we now believe that this is community spread, and that even nationwide there will probably be less attention on the contacts of where people have been, given how we believe that it's currently spreading now. And what that means is isolation is important to keep it from spreading, but it's the hygiene that everybody ought to be using, taking care of yourself the way that we've put up on our website and the CDC is recommending that is absolutely critical. So, Dr. Stack?
So again, like the governor said, the travel component is going to diminish in value now that the spread of the disease is happening locally. As far as places of business and places where people come together, we're recommending the same things we would do for influenza, which is surface cleaning, using regular commercially available cleaners to make sure areas are clean, and the personal hygiene interventions. The same things that minimize the spread of influenza will work to minimize the spread of COVID-19. Just because someone has traveled, or just because, no, I should be clear, just because someone has the disease doesn't mean that they have spread the disease everywhere they've been. If they're following those same kind of steps, personal hygiene, that helps minimize their risk of spreading to other people. And if those around them are doing social distancing, 6 feet distance, also not touching their face and their eyes, although I do that sometimes here with the heat of these lights, which is unfortunate. As you follow those practices, it helps keep everybody safe. And perhaps at the other end of this, the benefit is when we overcome COVID-19, when this becomes a matter of curiosity and hopefully not a present concern, hopefully we'll be better off and be protected from the flu and many other things if we help to socially train ourselves to have better hygiene overall.
Dr. Stack, how long does the virus live on hard surfaces? What is the...
We don't have good, reliable answers on that. So we really don't know if it's, I would just tell you we don't know. I've seen reports, but because the scientists are still working on it, I can't say for sure. If it's like other viruses, it could live for a few days at a time. It could live a little longer or a little shorter. The other thing we don't know yet is flu has seasonality to it. When the temperatures get warmer, it becomes less common. That's why you see it in the winter more often and not in the summer months. We don't know that yet about coronavirus. And so it's a very good question about how long it lives on solid surfaces. We don't know, but we do believe that the regular cleaning activities with sanitizers and Sanni-Wipes and the like, that those things help to reduce the virus, if not eliminate it entirely, and therefore help minimize spread.
So I have a two-part question. The first is, broadly speaking, what is the criteria right now to get a test for COVID-19? And then more specifically, when the clinician, when did the clinician ask for the test for the first COVID-19 patient? I know that the criteria was different then, and then what was the criteria at that time?
And I'll let Dr. Stack respond. We have followed the CDC guidelines to the letter. This is what they do. This is who we put our trust in at the national level. And their criteria has evolved as we learn more. One of the reasons we're doing this just about every day is we learn a little something more about this novel coronavirus every day, and we want to be fluid and flexible in how we get out that information. I can tell you that all of the providers for the first patient who tested positive agreed in the beginning that a test wasn't warranted, and that's because that's the type of information that we had from the CDC at the time. And I'm sure, given that this is brand new, 2.5 months old, that there will be more that we will learn that looking back, we wish we had different information. But I believe what we've seen in Kentucky is a lab that got up and running faster than many states, a very aggressive response that we are taking. We are endeavoring to be transparent in communicating with the public. What you saw from Harrison County and how they're putting out the information, I'm proud of our response thus far. It doesn't mean we're not dealing with something new and different, and we may have to change our approach at any time. But I can tell you that everybody is working as hard as they can, making the best decisions they can to protect all our loved ones out there.
Governor, I have a question for
let me-
Dr. Stack, too. Okay.
So to your point, the governor has already said it, but I'll reiterate it, and I'll thank you, because the way you asked that question is the kind of measured question I would ask the media and the public to ask. When we had our first patient, who then later turned positive, the treating clinicians, the treating facility, all of whom I've been in touch with through this process, all concurred, as well as my team, that the patient did not meet testing criteria as then published by the CDC. When the patient met criteria, and that the criteria involves CDC criteria and clinician judgment, when the parties agreed testing was indicated, testing was provided, and the patient was identified. So I think in this case, that patient was identified as quickly as we could, given the best knowledge we had available at that time and guidance from the CDC. Our hope, to be very clear, our hope is that commercial laboratories will quickly get up to speed, and when that happens, your regular doctor, your regular primary care provider, your regular local facility will be able to order the test and get it in the normal fashion, and then we won't have to talk about the limiting factor that the test is not yet as widely available as we want. And the final piece I would say, we want to drive everyone to our Kentucky COVID-19 website. I will share, though, that they may not thank me if I crash their website, but the Journal of the American Medical Association editor on March 6th interviewed Dr. Anthony Fauci from the National Institutes of Health. In the 35-minute podcast, he describes in crystal clarity what we know, how we found it out, and the progression that we can expect, both for testing and for treatments. And for those who want more detail, Dr. Fauci is one of our nation's most prominent experts on these topics and is definitely a source of credible information for those who are interested.
Doctor, the KHSAA has decided they're going to not have any restrictions. The girls' Sweet 16 this week, or the boys next week. Do you agree with that assessment? And do you have any special message for people who are going?
I support leaders who are responsible for their communities making the best decision they can. I continue to refer people to our website and CDC guidance. These are difficult decisions, and everybody responsible for unique patient populations has to make best use of the available information as we have it, and then make an informed decision about their own communities. So whenever I've been asked by a local health department leader, someone from a hospital, or other entities, what should they do, I give them the best guidance as I know it. I direct them to credible sources of information that can augment my advice to them, and then I tell them I want them to know that they have my personal support for exercising their best judgment and trying to protect their communities. So I won't second guess the decision that audience or any other has made. I want them to hear from me that I support their decision as long as they are working judiciously and expeditiously to try to protect their patient population.
Mayor Fisher,
And
if you could talk about your thinking right now.
Real quickly, I do, though, want to point people to the CDC guidance for those over 60 or those who are medically fragile. And you know, that's a term that's thrown out there. You ought to think very carefully if you have kidney, lung, or heart disease, or fall within the age group that the CDC has cautioned, given that they have put out that guidance.
Mayor Fisher, if you could just quickly talk about, I know it's early, but just your thinking regarding some of the big events coming up in Louisville, the Thunder, the Derby, things like that.
Right. Yeah, it's 47 days to the Kentucky Derby, so we're in close contact both with Churchill Downs and the Kentucky Derby Festival. And these events are varied. You know, some are outdoors, some are indoors, some have a lot of people, some don't have that many people. So those are some of the factors we're looking at, along with the increased incidence that we've got going on here or when it starts decreasing. So it's a daily kind of conversation that we'll be communicating on.
And to the point of the CDC's guidance with 60 and older counts, a large part of our working population is still 60 and older, and many of our lawmakers are. What is the advice to them?
Well, the practices that people can engage in work, you don't necessarily have to be in a crowd at work. It's the social distancing, 6 feet apart from each other, if that's possible. Washing your hands, again, twice as much, if not more, than you normally do, and washing them well. I've mentioned not washing them like my kids. My kids are now washing their hands in a very different way, and that was an important lesson to teach them. And I stand over them at least a couple times a day right now because it also reminds me of what we should be doing. We have not recommended at this time any work closures, but I believe you should adjust and prepare in work. Prepare on what you can do on telework. Put those plans in place. It doesn't hurt to be prepared. Make sure that that you have the type of cleaning equipment that we need, and maybe increase the amount that you do that. Make sure again that you look at your sick leave or other policies. You know, if you're running a factory and one person is staying home and you're picking up the bill for that, that's better than having to shut the entire thing for up to 14 days. This is an opportunity for folks to be ready. But at this time, we believe as long as people practice good hygiene, that we should be going to work.
Is the test free, or is there a cost associated with it now?
Well, what we are doing in Medicaid is ensuring there are none of those barriers, that there are no fees. The executive order that I'm putting out will eliminate copays and other charges in most major insurers, everyone that we have control over through the Department of Insurance. My goal and what we're going to get to is to make sure that there is no cost barrier to these tests.
Governor, everybody says they expect more cases. Is it too early to give projections of what you really expect?
Yes. I mean, we've had very limited testing with what's available out there. When private labs come online, we're going to have significantly more, and we're going to learn a lot. And we'll be right here talking about what we're learning and what type of practices we should change at that point. So we hope everybody is vigilant in listening, in getting good, accurate information, but again, remains calm. And we can't stop everything about our daily lives like work, but we can have better hygiene, better practices, and that'll help us to be a little bit better off in facing everything we normally face too.
Is there any timeline on those private labs coming online?
We were hoping in the next.
Some are already up now.
Right. Our timeline is we hope they're up immediately. But I believe that what we have been hearing for a couple of weeks is that it is imminent. I believe that I've read within a week or so here, but that's information we don't directly have.
Mr. Kopp, can you talk about isolation and what that exactly means and what's involved in that?
Well, we obviously follow the CDC guidelines. They're very specific about what to do with that sort of patient. Negative pressure rooms, personal protective devices are used for any interactions with the patient. So it truly is isolation of that patient in a room from the rest of the hospital, and any interaction with them is with protective device.
What is involved in the test?
So for the test, we obtain 2 specimens, one from the back of your nose and one from the back of your throat. And those tests are to make sure we have a good sample. And they run 2 tests on each patient currently. That way we can confirm it within the patient. And then they have confirmatory steps, for the actual test themselves. When the commercial labs come online, that may change. They may just require 1 sample, a nasopharyngeal swab. Initially, our lab will require those other commercial labs to send us specimens so we can validate the accuracy of their tests so that the public can have confidence in the results they're getting from other settings. And we do hope, I can't promise what the commercial sector can provide, but there are commercial labs who already have codes, who already have tests, and so if you go see your doctor, they can order it. The turnaround time currently being quoted is perhaps 3 to 4 days. That will come down with time. They have to ramp up capacity just like we had to at our lab.
All right. We'll take a few more.
So those tests are an hour, you get them back in an hour, is that what I believe?
Right now, for us, if we get them before noon on a day, we will have them processed by the end of that day. I think normally that's by about 6 o'clock that we aim for. If they're past noon, we will have them in the next day. Our period, which can be as small as 12 hours or even less, we're pretty proud of. That certainly cut down the time that the CDC was taking.
The second Harrison County case, is that in a medical facility or is that in isolation?
That person is in isolation. Those are the details that we can provide at the moment, but currently in isolation.
The other 3 cases, the first case is improved. Can you talk a little bit about how the rest of the people are doing?
Right now, it's so early. We can't talk about where they are, and there's limited information under HIPAA and others that we can provide. But everybody is in isolation. Everybody is getting care, and we're really glad to see that the first individual is improving.
Are you planning other briefings today, or will
We probably won't have another briefing today unless circumstances change. But yesterday, while we had to do it by video, we did it about an hour and a half after we got those results. Right now, with what I'd see is we probably ought to plan on having one of these generally every day or every other day. But we're gonna adjust that as needed. Crystal will work to be in as much communication as we can. Anything that is called quickly, we will make sure that we live stream so that everybody can get the information.
And will you let us know, please? We didn't know about yesterday.
Well, yesterday's we were working incredibly fast. Yes, we'll do our best to let everybody know. Just please understand with the way the situation is moving, and for us intending to give the information without delay, we're being as fluid and as flexible as we can. And of course, yesterday's announcement was at 5:45, and here we are at 8:45 the next morning. Thank you all very much.